In case you haven't heard, America's medical industry is pretty effed, but it doesn't have to be. Welcome to Right to the Root. I'm your host, Stephanie Wright, and I've built my career on helping practices reach their full potential. Join us as we dig down to the root of the insurance industry's most complex problems and how we might be able to turn it all around. Today, we continue our conversation with Dr. Susan Maples. We really talk about the insurance company and what motivates or really demotivates them to help our patients. And we're really getting down to the bottom of oral health system and how it pertains to the entire body.
Tell me, what was your tipping point? And 23 years ago, I believe is what you had told me, when you decided, like, I'm going to be independent from this. What were the cascading effect or something big? What was it?
So I've been in practice now for 40 years this coming July. And so we've been practicing a long time before, from 1985 to 2000, so 15 years. So Independence Day 2000, get it?
Yeah, that's pretty good.
July 4th was our day to decide not to have any more insurance contracts. And the impetus was to restore the doctor-patient relationship, to enter into relationships with patients, to make decisions with them. And it was my contention then that the insurance companies don't care. I mean, there's nobody, care comes from individuals, comes from, caring about each other, being in relationship. And to me, there's no one at the insurance company who cares about the patient. They care about their financial well-being, and they care about maintaining a contract with their employer. And it's all very transactional, right? It's not. So I wanted to restore the relationships that I thought made a difference for patients. And I wanted to take them out of the equation. And it meant, of course, that the insurance companies smacked me on the hand too, and that they don't pay my patients at the same rate. It is, but it's their way of trying to strong arm you into insurance contract. And trust me, they've done lots and lots of tampering with.
Oh, yeah.
Yeah. I mean, and you just have to say no. I mean, I built a hands-on learning lab for, on the Delta Dental board for a community effort. In the very last minute, they said, we can't give you any credit because you're not participating doctor, but you become participating, we'll give you all the credit. I mean, they tried all kinds of things to try to get me to. And I was like, you know what, I'm doing this for the public, not for you.
But I don't care that much. Like, you're providing such.
It's not that I'm caring people there. You're dealing with not people. You're dealing with a major corporation, an industry, a bureaucracy. It's not designed to care about people. It's designed to care about profitability.
Well, and you're absolutely right. And I mean, that goes back to when they stopped increasing the reimbursements, right, in 2012. And they just now started a little trickling, embarrassing amounts of like 3% here, 2% there. And, they've done it a couple of different times because they're running scared. But, these profits over patients things. And then when you get these denials or you get these little codes that come back as to why it's like bundling some of these things, or that it wasn't medically necessary, they write per consultant review. Wow. Who's the licensed provider? Like, who's the licensed doctor?
You do understand that there are all kinds of dental providers also trying to trick the system. They're so ticked off with insurance that they often commit fraudulent.
You're absolutely right.
This is one of the reasons why we stopped being non-par, because at that time in year 2000, I just finished all of Frank Spear's courses, and I was doing some aesthetic dentistry, and I was asking my friends, like, gosh, I mean, you were paying a couple $100 more in lab fees for anterior crowns. How do you charge the patient for that lab fee?
Yeah.
And they say, oh, we just sneak it down the side. We don't bill our insurance company for it. They have to pay it separately. Well, that's a violation of the contract you sign. And, even if I wanted to do that, which I did, I don't like violating contracts. I had 7 of my patients who were principals at Delta Dental. So I was like, there's no way I'm going to do that.
No.
To let go of the contract. so that I can actually do some of the work that I've been taught to do.
Yeah. Minimally invasive.
Do it at a loss. They weren't paying for TMJ exams. They weren't paying for diagnostic models with diagnostic wax-ups. They weren't paying for the kind of bicycle therapy we were doing for degenerative joint disease. They weren't paying for aesthetic dentistry. And so I either had to do that and not charge the patient because, by the way, the contract you signed says you will bill everything through us. And if we deny it and tell you can't charge the patient, you can't charge the patient. So you either decide you're going to do these things for nothing because you want to practice what you've learned and it's fun for you, or you decide that you can't have this contract and maintain your integrity. So for us, it was strictly an integrity issue. And it was also an issue of helping patients make better decisions for themselves between us so that we didn't have the insurance company deciding who could get what. Cash patients could get anything they wanted.
Yeah.
Insurance patients might be able to get covered for this. They might not. If they didn't get covered for it and I couldn't charge them, they weren't allowed to get it, or I would be in violation of contract. So the whole system didn't make sense. And that's why we did it.
It is. It's
never looked back, by the way.
Mind-numbing. You used a word that I train my clients and their team members in, and it's a very difficult one, is contracted. And I tell them all the time when we're making this decision, it's not non-participating, it's not out of network, because that patient looks at the booklet that they got from their employer, right? And there's 2 columns, in and out of network. And oftentimes in that health benefit, which they don't know is different than their dental, it's out of network is hardly any coverage. So when we say that we're no longer contracted with them as well, it allows us to give that few extra moments that we can provide some additional information and let them know why we decided we didn't want to. We can provide more transparency in their care as well too, and be more comprehensive, because at the end of the day, we can't do everything. That exam that they tell you that all of these tests need to be bundled and you get $58 and your lab cost would probably be more than that, the equipment, overhead, and everything. It's insanity. And so it's not sustainable. And what we're dealing with now, and Delta's not changing it. And we know that we can talk about the employers, right? And kind of get down to that root, because they're the ones that also make decisions, but they're not educated enough to make those decisions. And they're probably, it's like, a toddler being, hey, here's 3 different sets of clothes. Choose from this, right? Where do you want to spend money?
Employers, but if you think about it, the large corporations have unions that protect the employees. So they're going to negotiate at a table with union representatives in front of employees, and then the insurance people, and then the employer's leadership themselves. So it's a tricky game. And it's really all about the money.
Yeah.
All about the money.
Yeah.
The union people will say they care about their people, which I think is true, but they're trying to get the best plan, but it's a bargaining thing, right? It's a bargaining table. We'll take this, we'll give up that. We'll take orthodontics and we'll give up this. So it's like, it's not an easy thing. And we're not privy to some of I always say, before you criticize walk a mile in their shoes, I don't think it's possible for us to do that. I've thought about serving on the Delta board. Of course, they won't have me as a non-participating person, but I always want to go know thine enemy. I want to know, what is it that they're struggling with? Why can't they? Because they're considered nonprofit, and they come out with, in our community, they basically host and give money to anything that looks good in the community. Every running race.
Marketing is what that is for that.
Well, they're also trying to spend some of their money because they need to maintain a nonprofit status. So they have money, and they have foundation, and they have money to support. And it really is marketing. Of course it is. It's public relations. And I don't blame any company for doing some public relations and some marketing. We all do it. But the issue at hand is that it seems like breach of integrity for them, at least on my end, for them not to pay for preventive strategies like patient education.
Yeah.
They do still pay for some SRP, but they don't pay for For us with perio bundling, we bring a patient back as many times as necessary to get skills, beliefs, and habitual behaviors in place before there's any SRP. Who pays for those visits?
No.
Who pays for the salivary diagnostics? Who pays for the A1C test? Who pays for the sleep test? Even though there's ample evidence that if they're not cleaning their teeth properly, if they have Fusobacterium nucleatum and P. genvalis, and these are high levels of pathogenic bacteria present, your sharp instrument won't make a hill of beans of difference. What about the antibiotics and the chemotherapeutics necessary to help augment that? What about a sleep study to see if they're actually able to sleep? And what about, there's
go on.
We can test for 9 strains of candida that impact that are not visible with the human eye. And why is it that we can't surround some of this stuff and say, like, let's first of all do a really good diagnosis. Let's look at all the risk factors and see what we can do about it. Now, that takes tremendous education for dental offices. So I'm very critical of dental offices also in participating in these furious scrapings. And the patient says, I got my teeth cleaned. They charged hundreds of dollars instead of my normal fee, right? Yeah. And it didn't feel any different. And I want to go, that's a shame that they aren't understanding the treatment they're involved in. Now, that's not everyone. And the people who are going to listen to this are conscientious people.
Yeah. And I have to believe dentists believe on that same level. But again, who's going to pay for it, right? Going and transitioning to a model that is not at all dependent on insurance, it's scary. And it isn't for everybody. Like, I've had to tell plenty of doctors as well too. Yeah. It's, career suicide there, but it's exactly that. So that is almost like, well, this is the only thing that we can do because who else is going to pay for it? Otherwise the doctor loses out more on it,
More people are doing it. And as more people do it and talk about it, they'll recognize that this is not abnormal. When I did it, I was, in my community, Lansing, Michigan was the international headquarters for Buick Oldsmobile Cadillac. Yeah. The Michigan State there, which is a large university. It's also the state of Michigan. It's also Lansing School District, the East Lansing School District. It is 90% insured adults. And we were the only non-par practice in 100-mile radius, maybe.
Which is just phenomenal.
It's so different from like Springfield, Illinois at the time, or even Columbus, Ohio, which are also state capitals. Very different. Springfield had, probably at the time, 10 to 15% of people who were not in contract. So my place, I was a complete renegade, and people called all the time, dentists, well, how did you do it? And what did you do? I want to do that. And then over the years, you'd watch, they would think about it and not do it because they were afraid. And it is scary.
Yeah,
it is. To be able to offer something extraordinary so that when they go to another office, because they will, they're going to walk in and go like, I am not in Kansas anymore. I just want to click my heels and go home.
Yeah.
Go up, walk at your office because you deliver something extraordinary. And it's not just the friendly hygienist or the friendly person who asks about their vacation. Yeah. You can get that anywhere.
Yeah. It's, even assessing practices, I make sure that there is that loyalty. I can't have this revolving door of patients because guess what? You're not going to do well transitioning to not be dependent because you have a practice that is already doing that, right? And we're not emphasizing, we're not
loyalty.
We're not building a relationship with these patients that they don't care. They're not staying on it. Right. And so that is one of the number one indicators for me is, do I dig deeper, right? How do we identify that we have a practice that the doctor, he or she tells me exactly what they believe in, their philosophy of care. And then I go ahead and I look through in those data and that metrics as well, along with making sure what is the loyalty rate that we have. And we have to make sure that we're keeping our patients, which means they trust us.
How do you make sure of that? You have to make sure they are having extraordinary experiences one after another. They're only as good as their last experience. If you saved up all your money to take your sweetheart to a really, really fine restaurant for Valentine's Day coming up, and you went there and it was just so, it would be the last time, even though you may have been there 20 times before.
Absolutely.
So it's each and every time. And I'm going to also give you a little statistic that'll make you squirm in your seat right now, Stephanie. And that is that people who get their teeth cleaned twice a year don't have better oral health than people who don't. And that means that insurance companies know this and they continue to pay for 2 cleanings a year because of those bargaining tables. But if tomorrow the insurance company came out and said, we're only paying for 1 cleaning a year, who would be mad about that?
Oh, yeah, absolutely.
Who would be mad? And yet we as a dental profession are not doing the meaningful things that we need to do inside of those visits to ensure that our patients are healthier. What is that? Root cause analysis, working with them on lifestyle change, working with them on habit development, talking through what are those issues, taking a look at that blood sugar, taking a look at that sleep, taking a look at that nutrition, finding out why are we seeing dental disease? Let's put the instruments down and have a really significant conversation that could make a difference in changing the trajectory of what we see. But getting your teeth cleaned in a traditional dental office twice a year does not mean evidence-based, statistically speaking, does not mean you're a healthier patient than those who show up once a year or once every 2 years or once every 5 years. Isn't that sad?
It is. And you're making this full circle moment for me right now. When I was in Iceland and I was interviewing one of the dentists there and discussing that and asking about, they don't have any dental coverage unless it's adult with special needs and it's truly medically necessary, or pediatric care. And it's still minimal on the pediatric care side. So when I discussed things about periodontal disease, and it was just not really a thing. And then when I brought it up and she had told me, she was like, oh, patients maybe come like once a year, because I was curious. If you have a system where the patient has to pay in full the day of service, and so it's once a year, but yet they don't have these complex cases, they don't have all of these issues. Iceland is one of the healthiest countries around. They don't have processed food crap all over the place, right?
I tell you that if you yourself, I don't know what your caries risk is, but I'll ask you a personal question. If you yourself didn't go to a dentist for the next 3 years, would you expect to have cavities?
I don't really think so. I don't really think so.
Are you cavity prone?
I would say, when we were young growing up, I had a whole bunch of amalgams. I have quite a few crowns simply from clenching and still even with them,
Mechanical risk of fracture and things like that.
Yeah.
So need care. But as far as new decay?
I don't think so. I don't know when the last time I've ever had a filling.
Right. If you did, we would have to sit down and go, what's going on? What is that that's shifting that pH so that you're eking calcium out of your teeth to buffer the acid? How can we help? Yeah. What are you eating and drinking? Not just the sugar, but the acidity of things, what time of day, the frequency, like all of that. What's going on with your stomach acid, the acid reflux? How about the food you're eating? All of that, right?
Yeah.
So if we were to carry our weight in this whole healthcare crisis, we would be having these significant conversations and knowing how to do that rather than just looking for decay and fixing teeth. I know I've never had a proximal lesion, and I expect that I'm not going to. Now, something could change. I could find myself in chemotherapy and suddenly with saliva and, really shift things. And I don't, something could change. But for the most part, I'm just turned 65. I've never had a perio pocket or a cavity in my adult life. And I don't expect that it's the 6-month cleaning that's keeping me going.
No, I don't. I don't believe that either. And there's like this, as you're telling me these things that we're talking about, and you asked me how I feel if I went like three years, would anything change? I honestly, that mental psychology portion of it that you have to go, right? Yeah. That mental psychology that you leave and it feels clean, right? Across your front teeth and such. And it's crazy because, for instance, I use a Sonicare. I used manual toothbrush for the longest time, but now I have recession and my teeth feel cleaner. than they ever did when I started using it 10 years ago. I drank so much water all the time. Doesn't mean that I don't have an occasional soda. I like my Diet Coke.
Do you have any idea the pH of that water in that bottle?
I don't.
Yeah, well, that would be good to know.
Purified electrolytes added for taste. I guess I never even looked at that. How do we find out?
You just put a piece of litmus paper in it. I can send you one. Send me your address. I'll send you some litmus paper.
Yeah.
You may be sipping on acid water all the time, which also ekes calcium out of your bones and throws it through your kidneys. So you get osteoporosis and kidney stones and dental erosion. When I say that to you, if you say I'm drinking a shit ton of water at a pH of 4, I'm going to tell you that's a problem.
Yeah, I would think so.
And the other aspect of that is you're thin and Caucasian, and you're at the highest risk on the planet for osteoporosis. So you can't afford to be drinking acidic beverages all day.
Yeah, my mother, she's shrunk already from osteoporosis. So
the point of the matter is you assume that water is the healthiest thing you can drink, and you have no idea. That's governed by the FDA, not the EPA. You don't really know the pH of that at all. Yeah.
You're blowing my mind. I'm like, okay, so now I have more questions as the patient, right?
Uh-huh.
This is part of the beauty of this podcast as well, too, is I know I'm also like, I'm the consumer as well, too, right? I know you guys are, but doctors can tell patients all day long about these things. But here I am as like a normal human working in dentistry, and I'm still thinking like, what the heck? So tell me, what are some of the bottled waters that are out there? The only reason why I'm drinking a true bottled water, not tap, is our new house. We're getting reverse osmosis because it's high in iron and sulfur, and it's disgusting. So tell me, like.
Well, let me ask you, Stephanie, do you have children?
I do.
How old?
My biological children are goodness gracious, 15 and 16. And then I have other children that are 13, 16, 20, and 23.
How do your 15 and 16-year-olds feel about you throwing away so much plastic into a world that...
Oh, they hate it. I hate it too.
Right. So why are you doing
it? And that's, I know.
I
don't have.
I'm asking tough stuff for you, right?
You are, but it holds me accountable. For Hanukkah one year, my kids had decided that they were like, we want to use less single-use plastics, and we did very, very well. And it's something that I cringe on.
Do you have a refrigerator that has water that comes out of it? Change the filter.
I know, I'm so ashamed right now.
Change the filter. Do all that and stop throwing stuff out. I honestly, if you walked into that plastic factory and smelled the smell of those bottles right off the press, you would not want to drink anything out of them.
I completely agree. We have glass, like as any of our containers in the house for like heating up something. And I will tell you, up until just now moving in this house, bottled water I always carried a bottle of water like that from my tap as well too. But this just goes to show that the value of the time that we're spending together. I want to point it out for the regular public that's out there. I've been in dentistry for over 20 years. And although I don't like having single-use plastics, I'll do whatever I can to avoid that. Even when it comes down to having my Diet Coke, which I know is awful for me.
I have to laugh that you're drinking Diet Coke, but worried about the water. Sorry.
It's true. You have to laugh away because I know it's absolutely awful. So it's my guilty pleasure. Maybe twice a week to have, and I buy the little mini cans because it is. But I mean, you're talking to me, and here I am thinking, I don't know what all this sulfur and everything that's in my water from my well, it just smells like crap, what that's going to do to my overall health. So here I am, I go and grab this.
Or the Diet Coke. Yeah. I'm not worried about it.
I know.
No idea where they got the water to make the Diet Coke. But anyway, I know it's funny, but I have to say this. For other reasons, I am mad enough about the processed food industry with the amount of chemicals that we are allowed to consume, from flavors and thickeners and emulsifiers and preservatives and colorants. It is making us sick, and these chemicals have not been vetted out for human use, including your diet soda. And I want to say to you that, well, for me personally, I'm mad enough that I refuse to give them money to buy my disease.
Yeah.
I am not doing it. Buy real food, cook real food, drink real water, get a soda stream, pull the water out of the refrigerator, your reverse osmosis, bubble it up. If you want to squeeze a lemon in it once in a while, do that. But I mean, I would be careful trusting anything in a box or a bag. These companies are getting rich off our backs. We wouldn't need prevention if we could clean up the freaking food and drink supply.
It's absolutely terrible. I'm very fortunate that
good time for me to plug the Brave Parent book. Brave Parent, Raising Healthy, Happy Kids Against All Odds in Today's World. And Stephanie, I want you to read or listen to it.
Absolutely.
And I want you to read or listen to it as if you were the child.
Yeah.
Because I want you to talk to yourself. Kids do what their parents do, not what they say. So if you're bringing those little Diet Coke things into your home, your kids see it.
Yeah.
Their little guilty pleasure.
You're spot on.
They're going to tell you, well, I only smoke a couple times a week. It's my guilty pleasure. And you're like, oh God, really? Right?
But it's true. I mean, everything that you're absolutely saying is true. And here I am this entire time thinking about how really well my kids eat. Like I mean, down to the most disgusting thing. Like I don't allow like hot dogs and all that crap in the house. We have a garden. We eat right from the garden. We grow our, all of our lettuce.
I love that.
And my boys actually will eat a lot of that stuff. But then here it is. It's like, hey guys, don't drink the water.
Yep. Yeah.
I just never even thought about it on those different.
Tell them that your efforts, you're going to take a New Year's resolution effort to get rid of your Diet Coke and make it verbal and set up. And then you say, what are you guys willing to either go for or get rid of to enhance your health? Let's all pick an effort, an intention. And then if you need to cheat, don't do it in front of them.
Yeah. Yeah.
And I say that I believe in integrity, but I also know that you're setting examples and for them to say, look, my mom does it and she's fine. Like,
I absolutely agree.
Yeah.
It's,
plus just giving them that, it's not a lot of diet soda. So I'm not hating on your diet soda. I'm just saying giving the company money. And by the way, that is 10,000 times more acidic than your body. So if you really don't want to become your mom and shrink, stop putting acid in your body. Just telling you right now. Okay.
So. Well, and aspartame and just my kids, it's so funny. In the summertime, we have a pool, those Zevia drinks. And now I'm curious about those because those are the ones that I was like in the summertime for sitting next to the pool, like the kids can have. And now I'm going to be starting to test it. Right? Like I didn't, I see all these things and you see the little boards that will show like the Gatorade bottle and how much sugar is in it. And then, like the soda bottle and how much sugar is in it. And you see all these different things, to help you educate on that. And I think visually, like that sugar aspect of it is certainly effective. However, it goes so much deeper because again, like you brought the door.
Yeah. But really interestingly, this morning, my sweetheart, we had his grandkids, grandchild 3.5 for breakfast, and we all ate these yogurt parfaits, and I loved it. I don't usually eat. I like yogurt. I just don't eat it. So I'm eating it, and I'm tasting this yogurt. I make my own granola. We had fruit in it, and I said, "What is this yogurt?" And he's like, "It's Chobani." And I said, "Well," I picked it up to look at it, and I go like, "Okay, it's lactose free. How do they make lactose free yogurt?" They put in lactate vegetable juice, which is obviously something that's a vat of chemical stuff to, undo the lactose that's in the milk product. And then it's sweetened with no sugar added, but it tastes sweet. So I'm like, what's in it? It was stevia, which is, again, most people go, is that a good one? I mean, I could taste it. I was like, there's no way I'm not eating. And he's thinking it's the healthiest thing ever because it's whole yogurt. But he's like, well, what kind of yogurt should I get? I didn't know, he's just buying yogurt every day.
Greek. Well, and it's coming in the single-use plastic as well, too.
Of course. And of course, it's not recyclable, but why? Right.
Yeah.
We can't really get away from all single-use plastic. And, we're in dental office, we're throwing stuff out all day, but it's, when your lettuce is in there and it's like these unbelievable bins of plastic that are going in. So, but I still feel like we could do better by carrying around, glass mugs and refill containers and wherever we can.
Yeah.
And talk about it out loud, your efforts, so your kids know that you care about their future.
No, I honestly, and I know the fridge has that. I don't know what compelled me to get some cases of water. I don't know if it was just all of a sudden this like disgusting water, and I drink water all day long, that I was like, I have to have some,
like at room temperature, replace your refrigerator filter on your refrigerator and call it good.
Yeah.
Like, it's going to be better than the bottled water you're drinking.
Oh my gosh, is it ever? Yeah, and you're right. Like the room temperature, I don't ever want it out of the fridge as well too. So that might be a little bit of a deterrent. But honestly, it was more of just like that. I need this quick convenience, and that's the world we live in, right? I need this quick solution.
And then hold your bottle up really quick for me.
Okay, so what do you have here?
No, I want to see, is it crinkled? Have you crinkled it yet?
Oh yeah,
yeah. Because when you squeeze it, of course, it releases chemicals. So the thinner it is, the better it is for the environment, but it's worse because it's easy to crinkle, which releases some of those chemicals into the water. Yeah. And if you buy like Fiji water, like any waters that are traveling a distance in the heat, that's an issue too. So you have to be careful about where it comes from. And it's usually not labeled. You don't have any idea. So I'll send you some pH papers and you
absolutely. Well, and now I'm curious to know, so we have well water out here, which everybody with wells, it can obviously vary. I grew up on well water and it was the most delicious, crisp tasting water ever. And here we are with that, like that eggy sulfur smell. It's iron. I can see it in the water as well too. And so we just moved in less than 2 weeks ago. And so what is city water looking like with as far as like pH?
It depends, on first of all, the Environmental Protection Agency only guarantees the water up to your doorstep. So a lot of it depends on the pipes in your house, right?
Mm-hmm. Yeah.
So they can't like rebuild your house for you. They can only deliver it to your house, right? And so that makes a difference. But the same is true of a well.
Yeah.
And if your well isn't tasting good, you may try digging a deeper well. It's not that expensive.
Yeah, that's true.
Could ask your neighbors, how's your water? Did anybody put in a new well? You probably get on a neighborhood, thing and say, has anyone had it tested? Because your county, at least our county, pays for water analysis for free. You just take it from your thing and put it in there. So a lot of it is just the well itself. When 20 years ago, I built a cottage with my best girlfriend out in a rural area. And we had to put in a new well because it was right where we were building. And all of a sudden our neighbor's like, oh my gosh, we're putting in a new well too, because we went 25 feet deeper and our water was pristine.
Really?
Of course, the well was new too. So you weren't.
Well, I mean, our well is new, but like, what is that?
I don't know. I don't know what I'm talking about.
Look into this.
Yeah, I really don't know what I'm talking about. I just know my own personal experience. So I'm not an expert on wells. That's a really good question though. And again, water comes from the earth, right? And so the processed water that we're thinking of where it's recycled and they add chlorine to in all of that. I mean, it has its challenges. It's all what you've gotten used to. Is one water better than the other? If you want it, get the reverse osmosis. It'll be a small price to pay.
Yeah, we are getting that for sure.
Yeah, so get that. Meantime, buy a Brita filter at Target and call it a day. What?
So shame.
It's easy.
You come to the get-go watching me take sips.
No, I just think it's not that. It's not watching you take sips. Everyone does it. It's bragging about it. It's drinking. I go.
It is so bad, but it's so true.
No, honestly, I try very hard to judge 1% less every day of my life. I'm not judgy. I just love to help because I think
it's true. You're not
home. We're all here walking the same challenges together. We really are.
Well, you're absolutely right. And I think that, one of the things that when I work with teams as well too, right, is like embrace the knowledge other people have. Don't hoard it, right? Like we rise by lifting others by giving them that knowledge as well too. And don't tear people down either, right?
Yeah.
And so you having this discussion with me, never once did I feel like judged and picking around about it, but it's mind blowing to me. And it's so important because again, too, we have this very instant gratification society. That was exactly what I did with getting cases of water. I tasted the water, was like, I can't live like this. I drink lots of water. And I didn't think about the other sources even available to me, or as a whole, completely ignorant to how bad some of these waters. Like, I knew some of them. I've seen some studies. I guess I just never even really focused too hard on it because previously it was, I just seldom drink bottled water, but now I'm like, oh my gosh. This is amazing information.
I love that you have kids at home because you can learn from them. They become your greatest teachers. And some of it is to say, I want to be better for you. And I want to make a personal intention to throw less plastic out this year. I also want to treat my body better. And I want to really try to move away from all single-use containers as much as I can.
Yeah.
And that includes my diet soda. And I'm going to work at that because that one's hard for me. It's something I really, really enjoy. But I know that it's a habit and I know it's not good for me. And I'm going to work at that. And if you guys have any intentions on what you'd like to work at toward your health, I'm all ears. I'll support you. You can support me.
You're just such an incredible woman. I've always admired you. And, even when I was talking to Dr. Paul Henney on Friday, I think it was, and he had actually mentioned your name. And if I knew, I was like, well, a few years back, I helped with some things on software over the phone. But, and I did. I knew that you were a national speaker and educator as well on top of it. I knew that your practice was independent from any insurance. It's amazing until you really start to talk with somebody that is genuine as far as the care of the overall health. It's not, and a lot of it's just common sense. It was just like the thing with the water and like this instant gratification. And you can hear passion in everything that you discuss.
Well, whatever it is I can do to help you fulfill that purpose that you have, I would love to help you. It's how we do it, right?
Yeah.
This isn't your purpose, drinking good water, but your purpose is helping people reclaim their space in the doctor-patient relationship and forge good relationships with patients and make a difference. And I'm thinking that you're wanting to only deal with clients who are very high integrity and are working toward the same, finding people who share your values.
Yeah.
So I can help you with that. I'm happy to.
I would love that. And I'm willing to cross the aisle, right? And to say, if somebody has something other significance, like, let's hear about it, right? Like, and the thing is like, because we're not going to be able to promote change in anything if we're not able to communicate with the people we don't necessarily agree with on things. And so again, it's, having the discussions, learning from everybody for total health, that it goes well beyond your practice for, total health dentistry. It's everybody should be focusing on is the medical doctors, the, emergency room. Why is somebody coming in here? It just is. Yeah. You're just such a phenomenal doctor.
Oh,
I'm so grateful. And I feel as though I'm going to be visiting some of these countries and learning some things. And I'm going to be texting you and saying, we have to get back on another. I would love to hear your thoughts on this because I'll be in Chile in April. I'm hoping to do Brazil as well too. And,
nice.
So I just.
What are you doing over there?
So I'm interviewing doctors.
Yeah.
So yes. So I want to know about the health systems that are there, both medical and dental, which I'm finding every country I speak to, dentistry is just not a component of it, which is sad. I want us to learn about the different types of health systems. I learned from Kurt Lindbergh, who's a doctor here in Holland, interviewing him, and he said that we have to stop using the word universal health because then we just shut down the listeners, right? And I'm not saying that that's a perfect system, but we have to focus on some we have to focus on comprehensive prevention. And I'm hoping to find something. I'm hoping that will help people up higher, right? Like
I laugh because I often speak to medical groups and I can talk about why we have failed to integrate dentistry into medicine. And I often say, I absolutely know why they leave it out of the curriculum at medical school because it's way too difficult for the physicians to understand. And they laugh. And then I go, the truth is it's really difficult for dentists to understand too. There are complexities in the mouth that don't exist in the rest of the body.
Yeah.
But why do we lose bone around teeth and don't grow it back like we do elsewhere? Why does a disease like periodontal disease, which is so systemic and so inflammatory, not give you symptoms?
Yeah.
Why is it that we have grooves in teeth? That seems to be a design flaw. I mean, these are all questions I'll ask God when I get to see him face to face.
Yeah.
There are some complexities. The mouth is a home to about 900 different strains of bacteria. Some of them are protective and great. Some of them are flat out dangerous to the rest of the body, which is why we have a nice acid trap so you can't swallow to the gut. But now we've wrecked the acid trap from all these PPIs, proton pump inhibitors from reflux, and many of them have moved into the gut. And that adaptation is an issue. But we have so many complexities that separate the mouth, the microbiome of the mouth from the microbiome of the vagina, of the gut, of the sinus cavities, of all that we have our own arena, but it is a really difficult area for many people to understand. Right off the bat, the only part of the ectoderm, the outer covering of the body that doesn't heal upon insult, is the teeth. If you scratch the cornea of your eye, you break a fingernail, you cut your skin, you lose a brow, you give yourself a bad hair dye, it all grows back except the teeth. So there are complexities that are immeasurable in other areas of the body. And we have to give respect to the fact that it's become its own field of study. So putting the mouth back in the body is not as easy of what were we thinking? Of course. Of course. But it's also, we have a long way to go to educate our medical colleagues, and we all ought to be helpful in that and not critical of that. You know, we're critical that they're not looking for sleep apnea. They're not looking for decay. They have no idea what periodontal disease is. Well, how could they do a hip replacement without checking on perio? They don't know. They just don't know. And it's up to us to help bridge that gap.
I mean, I feel leaving this conversation and this recording, I have so much more in regards to how I feel about dentistry as a whole and how I feel about, bringing together, because I have said up until this moment of talking to you is that it need to be considered because it's whole health, right? Like total health should be all with medical because it's part of medical. But now as I'm listening to you, I knew the mouth is complex, right? I know that as I was discussing periodontal disease, there's so many different factors that are involved, but you just added mind-blowing layers that are so simple facts that I've always known, but you put them all into one description to help me understand why it's not so simple to just throw it together and how complex the mouth actually is. Like, you think of all the different things of, teeth,
it's got tremendous telltale signs of what's going on in the rest of the body. The very first manifestation of diabetes shows up there, but dentists don't think about diabetes. They think you're not brushing your teeth. That's why they're bleeding, right? Yeah. So we have to also be willing to learn, about what are the 6 or 7 telltale signs of obstructive sleep airway disorders in children before they get to have OSA. What we have to get better also at recognizing what those precursors are. How do we recognize acid reflux before they get esophageal cancer, right? Yeah. We see it in the mouth, on the gum tissue. We see nutrient deficiencies. We see chemical sensitivities. We see food sensitivities. We see all of it. But we don't see it because we're not trained to see it. Yeah. We have to start looking at the mouth with superpowered eyes, seeing things differently and opening our minds to what are we seeing. If I see red gums from the tip of the gingiva down to the mucogingival junction, that's not a toothbrushing issue. That's chronic inflammation, not a red rim around the teeth, right?
Yeah.
So you see things differently. Anyway, I'm going on and on.
Great. You're incredible. And I'm so excited to be able to learn what's happening in other countries, learn how are they tying into total health dentistry, right? Because to me, I was leaving these different countries and being like, well, they just treat dentistry the same, right? Like nobody has any care for it. Maybe some pediatrics, maybe not. And it's like, it never once occurred to me the complexity that would take to intermingle these two. And, it's not to say that it's completely impossible, but it is not an easy solution in the slightest bit.
No,
it is. I'm really excited. And I'm hoping that,
When's your next trip?
What's that?
When's your next trip?
I actually go down to Florida. I'm going to be interviewing Dr. Alan Stern. And then one of my clients, he's a third generation dentist. He's retired now as well too. So I always discuss generational dentistry when a new doctor is going into a dental practice that is a retiring.
Where are you going in Florida?
I fly into Naples I'm going to Naples. I'm flying into, I can't remember, RSW.
When?
On the 29th, and then I come back on the 1st.
Okay. I was going to say, I'm flying to, where am I going this week? Fort Lauderdale to speak. I thought maybe we'd be in the same place by accident.
Oh, I would absolutely come there as well too. Yeah. Nope. Those are two doctors that I'm going to do. Howard Ferran. Yeah, I was really excited. I didn't think he'd even be back, to be honest. It's not like I have a large name. I don't insert myself into these large associations for dental practice management consultants. I like staying as small as I am. And same reason why doctors like yourself, the time you can spend with them, it's quality, not quantity. And so I didn't know if he'd even respond to what I feel is like just a no. They did. So it's incredible. And Dr. Stern, he reached out after a post that I made on social media. And so I want to continue to. And then I'm just looking up online. I will say doctors in France, and I just keep grabbing emails, and I have probably sent out thousands and I'm only getting a couple back, but that couple it's huge, right? So I'm hoping that I can bring a lot back to educate people.
Sounds great.
Yeah. All right. Well, thank you again so much.
My pleasure. We'll talk again, I'm sure.
Yes, absolutely. Thank you so much. Take care. We'll see you later.
Bye.